Can everyone see power chart here on the left? Okay.
Information that Dr. Newland can see things.
I couldn't hear you. I'm sorry. You were very faint. What did you say?
Do you have confirmation that Dr. Nimula is on and can see and hear everything?
So I can see that Dr. Nimala is on, but I can't confirm that he can see my screen. But if you guys can, he should be able to. So here on the left, I've gone ahead and opened my power chart application. It's a blue P, which you'll see on your storefront. Currently, I'm logged in as a physician, and today we're going to be covering our clinic workflow page. So here on the left, I have my message center, which was reviewed in an earlier call, my inbox items, work items, and notifications. Here on the right, I have my ambulatory organizer, and I can see my schedule for the day. So for today, I've scheduled a test patient to Dr. McNamara for 1:10. So I can see which clinic, the time of the appointment, how long they were scheduled for, the name, age, and gender of my patient. When I put my cursor on the name of my patient, I can see their date of birth along with their phone number, the type of appointment they were scheduled for, their status in the system, if a room number is associated with our patient, and any notes that may have been left by staff. All of this can be seen on our day view, which is selected for today. Within the ambulatory organizer, I also have my calendar, which will allow me to see my schedule for the week, or just today kind of broken out in a different format. So if I select my physician from earlier, I can see all the available slots and my blue scheduled appointment. If I wanted to see only today's view, I can select day and I'll see that breakdown. Our next item is open items. Go ahead and pull in a resource. And on this screen, it's going to show you, so maybe I saw 6 patients yesterday and I didn't finish notes on 2 of them. Those patients will be listed here, reminding me to complete those documents. It does also go 7 days in the past, and I can choose to go further if I need to by clicking view 7 more days. And it'll just pull back further in the past. Upcoming will show you future scheduled procedures. So if any of your team are surgeons and they're scheduled at the hospital, you'll see those surgical cases on this screen. For now, I'm going to go back to today.
What's in the open items? Those are like labs and x-rays that have not been reviewed?
So open items, maybe you didn't put in a visit charge on a patient, you didn't sign off on a note for a patient, maybe you just saved it and you were going to come back and finish it when you moved on to your next one. They'll show up in that section as like a reminder to finish them. Now, your question, I remember you said you ordered like a lab test or a radiology test. Those results are going to come back under results here on the left. Okay. I go back to data. To access my patient record, I'm simply going to click the name of my patient, and it's going to pull into the record. I'm going to use our ambulatory workflow page in the clinic setting. In the hospital, I'd use that inpatient workflow along with discharge. At the top, we have our demographics bar, so I can see the name of my patient, their allergies, advanced directive information, age and gender, or height and weight, who their PCP is, who's seeing them today, along with the location they were scheduled in. And I can also see their financial number and the type of appointment, so clinic. Code status also displays here. What I just kind of went over here at the top, our demographics bar, is going to look the same in the inpatient setting. Okay. So back in our workflow for clinic, I'm just going to give you a very high-level overview of what each of these sections do, what we call components. If you have questions, please stop me. So our first section is our chief complaint. This is going to flow over from that nursing intake. As the provider, you can still get in to edit that. So maybe they've also had chest pain. And I can choose to sign that into the record here on the right side of the screen. And that's going to update it from my documentation. Vital signs gathered by my staff. So I'll be able to see their blood pressures in the last 18 months. If this patient had multiple line items, if I select the header of that section, so where it says BP for this one, I'll get a graph of those values and I'll be able to see those previous values. Now, maybe this was a lab test, maybe it's a creatinine and I can't remember the reference range for some reason. If I click the value itself, I'll get my normals and I'll get my critical values that will display. So labs is going to function just like this section.
Is there a way for us to add, say we recheck the blood pressure during the visit? Is there a way to change that or add a new one?
Yes, so there's a way to chart, like let's say you asked for a manual or you needed orthostatic or just a simple repeat. Here on the right, there's a drop down for ambulatory vitals, height and weight, and you can just put in those. So let's see. So maybe you rechecked it and it was 125/60 and I signed this in. Now I'll have two data points. So I can click the BP and I'll get a graph, or I can click the value and it will show me those reference ranges.
Okay, thank you.
Of course. So on the right here, I mentioned my 18 months. I also have different date range filters. So if only I wanted the only last 6 months or just the last 1 month because this patient's been here a lot, you can see those filters. There's also a view option here on the right, one that looks like a little grid or 2 columns. If I click the little grid, it's a little bit more condensed. It's just kind of up to personal preference on the view. Moving down, I can see my home medications. So on the left here, I have a little scroll icon. This indicates a documented home med that nursing typed in. The other option you may see is what looks like a little pill bottle, and that will just indicate that it's been prescribed on the Cerner system or it was pulled over from a pharmacy history. I know nursing staff has completed their med history because on the right side of the screen, I have a check mark next to that. Every clinic visit, you're responsible for completing a med reconciliation, which is going to be over here on the right for outpatient, but I'm going to come back to that. Next, we have allergies, so I can see my patient's allergic to codeine, which is also in that demographics bar. But what's nice is here on the right, there's an additional search box. So if my patient's allergic to something else, so maybe they told you were allergic to amoxicillin, I can put that in. And it'll just ask me to choose the severity. So if it's moderate, severe, or mild. And then I can save that to the record. When I refresh my screen in the upper right where it says 4 minutes ago, that'll update our demographics bar. Next, I have our history section, so I can see chronic problems for our patient of asthma, COPD, and diabetes. And just like allergies, I have that quick add function here on the right if I need to add a chronic problem. Procedure history, so I can see that my patient had a chole in 1980, along with that add procedure search box if needed. Family history results, social history results, along with pregnancy history on female patients. Our next section is lab results. So it's going to be that grid-like format we just saw in vital signs, except it'll say a white cell count and you'll have your value, platelets, you kind of get the idea. We talked about being able to click the header of the section and creating a graph or clicking the value itself to see the reference ranges. Our lab section is going to function exactly like that. I do also have date ranges here on the right, so I can see all visits or just labs within maybe the last 6 months if you're looking to compare. Diagnostics, you're going to be able to access the reports directly from here. It'll be a little blue bar that you'll click, it'll pull to the report, and you'll be able to read it. Microbiology, it'll pull to the report along with pathology. Very similar components here. Next, we have order profile, and this is going to show you everything that's been ordered on the patient that's on the system. This is also going to include future lab orders. So maybe at a patient's last med management, you went ahead and ordered their 6-month labs, and then they present today for something acute. You'll be able to see that CBC or A1C that you may have ordered. Outstanding orders, these will just document home meds in this case, but any orders that haven't been completed. Any questions on that first grouping of workflow page components? Did someone say something I couldn't hear?
Can you hear me?
Yes, I can now.
Dr. Baumer wanted to know if the order of those headings is fixed, or if, say, he wanted to have the review systems at the higher, higher on the list, can those be customized?
Yes. So maybe I want my new order entry where I place my orders towards the top. I'm just going to left click and pull it. And this is an individual order, so you control the order you see it in. Okay. Problem list. This is where you're going to add your diagnosis for today's visit. So there's a search box here on the right. So they came in with shortness of breath, and maybe they have pneumonia. So you can just look for that. If I can type pneumonia. This is going to pull in as my primary diagnosis for this visit. And maybe their COPD is also a contributing factor today along with their asthma. So I can simply click this visit and it's going to add it as part of my diagnosis for today. Now I have in red here my HCC for diabetes. Those chronic health conditions need to be evaluated yearly during a PCP-like appointment. So diabetes just hasn't been addressed yet this calendar year on the Cerner system. I can continue to add here on the right.
Lisa?
Yes.
Okay, so what if we don't update those every year? Does it alert us? Does it flash and say, hey, we forgot to update this diagnosis?
So what if we don't update those every year and then I couldn't make out the second part of it?
Yeah, so if we don't update it every year, what happens? Do we get an alert? Does it not let you go forward?
It's going to continue to stay in red.
In red. Okay.
And your quality team should be able to run a report.
Gotcha. Thank you.
Something else I want to point out, resolved chronic problems. So I know we just talked about diabetes here, but maybe through diet and exercise they're no longer diabetic. It can be resolved and you'll have access to that information. Maybe this patient was just here last week with strep. Under all previous this visit problems, you'll be able to see that list of diagnosis from prior appointments. This is great if somebody was just in the ED and then showed up here, you'll be able to see it. Okay.
Can I ask you a question related to that?
Of course.
So you have a diagnosis, say, for diabetes on there, and then if the patient develops neuropathy, and so then the HCC code is updated to diabetes with neuropathy, do we resolve the plain old diabetes, or is there a way to make that go away so that the diabetes with neuropathy is the only diagnosis visible?
So let's say it looks like this and you did diabetic neuropathy. We'll just go with type 2 in this. It's technically a second diagnosis on this. So if you wanted to mark this one as chronic and then just remove it, you would uncheck chronic. And it's like it was struck through on the record because you updated it. Okay. So let's say our diabetic neuropathy is actually our primary diagnosis here on the left. If I click the drop down to the right of the 4, I can simply toggle those and rearrange them as I see fit. This is going to correct my order on any future orders that I place, and it's also going to associate that order to my assessment and plan. So my diabetic neuropathy is going to be my primary and then have pneumonia underneath. Any questions around manipulating our problem list?
So you changed the number on the priority. You can't just click and grab those?
Nope, there's not a click and drag. So I'll just change that number. Anything else for that section? Okay. Next, we have new order entry. This is where you're going to order anything the patient may need. So labs, radiology, patient care items in the clinic, your visit charges. You can order prescriptions from here if they needed test strips or a diabetic shoe. You can also write that prescription from here. So they can take it. So I'll come back to new order entry and we'll talk about that when we come back to flow. Next, I have documents. These are going to be previously completed notes on your patient. Here on the right, if I click change filter, just to give you an idea of what's in here, consultation notes, discharge summaries, ED documentation, H&Ps, your office clinic notes, anything that may come from an outside scan facility, so outside scan documents, nursing charting, procedure op notes, and messages and letters that are sent related to this patient. You have your date ranges here on the right, and you can also choose to see only your documentation by toggling this button. Next, we kind of get down to our notes sections. So if you look on my screen, I have my HPI, my review of systems, my physical exam, and patient instructions. To utilize this screen, I'm just going to click in the box and begin to type. Or we have something called Cerner Auto Text. So our icon here on the right is Manage Auto Text. And then I can go up to public phrases. And to give you an idea, there's 47 pages of pre-built stuff. But you can choose to have your own pre-built content on this screen. So maybe this is my standard header for kind of the med management appointment that I'll have in the clinic. I can use my mouse to highlight that information, right click and copy. And then when I go to my manage auto text, I can go to the plus and just paste this information in. My abbreviation, I'm just going to pick a symbol on my keyboard. So I'll just do a slash in the word test. And I'm going to go ahead and save this box. When I close this pop-up, now pretend this is my next patient on my schedule, I can do slash test for my med management and pull it straight in. So you have the ability to build your own auto text. To give you an idea of what's pre-built already in Cerner under review of systems, if I put in a period in a lowercase r, I'll see my drop-down version. So my ROS complete. This is a pre-built review of systems template that you can utilize. So my term is blue. I can double click on that item or press enter, and it's going to flow into my note. So kind of looking at this where it's blue for no, I can click and toggle to +4. The other option is on my keyboard. If I press F9, I can toggle between the drop downs. Do you guys have dictation software? Or Dragon? I can tell you unmuted your line, but I can't hear you.
Yes, we do have Dragon.
You have Dragon? Okay. So pre-built in our system then, if I put in a period and a capital R, I'll see my ROS complete. Uppercase is Dragon, lowercase is going to be those drop downs. So I'm just going to press enter on my keyboard and that pulls in. So our brackets here are for Dragon. You're probably used to it though. You can say next field, it'll highlight that bracketed term and you can dictate over it. Now keep in mind you can build your own templates for this. So maybe you have a pediatric review of systems or an acute review of systems that you pull in instead of your standard full one. Under our physical exam, the kind of that same principle, a period and a capital P, we'll pull in our physical exam auto text. So I've got that PE complete. And I'll just press enter on my keyboard and that's going to flow in. The drop-down version is a period in a lowercase p, and that will pull in. So it's kind of up to personal preference. Something else you can do with documentation, if you have an underscore, if you press F3 on your keyboard in Cerner, it will pull between those, if you're maybe more of a typer.
Can you repeat that, please?
Yes. Yes. So if I put an underscore on my note or build into my template and I press F3, it will pull between those underscores. So I can use Dragon to pull between the brackets. I can use F9 to pull between the drop downs, or if I prefer to type still, I can use F3 to pull between the drop downs or my underscores. So maybe in this template for Dragon, instead of alert and oriented ×4, I have awake alert and underscore. I can press F3 and just type in the respective number. So that's just another documentation option. Okay. Patient instructions is a free text section that you can drag into by clicking into that box, type, or have a Cerner auto text that you pull up. Anything you write in this section prints out directly as part of the paperwork the patient goes home with. It says in big letters, directions from your doctor, and it'll have anything you type in that field. Next, I have my patient education templates. So here on the left, I can see the diagnosis that I pre-selected. And on the right, I'm going to get some templates that I can choose. So let's say I want to pull in my asthma acute or chronic lung disease controlling stress. I'll just simply left click on that template and it's going to add below. Something I like to point out here on the left, if you need a different language, we have some preset defaults you can choose from. Not every template's available in every language, but we have a good amount of each. Maybe I'd like to see the contents of the template I'm giving my patient, so I want to open up my chronic lung disease instructions. I can click modify, and this will open up for me. So maybe I don't want the picture in my template. I can just click it and press delete on my keyboard. This is a Word document. You can kind of treat it as such. So I can click in here and type at any point. I can also use my Dragon to just click in here and freely dictate. Maybe I've made my modifications as I see fit and I want to save this so I don't have to change it each time. On the left, I can right click and save as a personal custom instruction. And then I can change my name. So this is my chronic lung disease. Maybe this is really for COPD for me. I can change that title and then I can click OK. So now it's going to save my favorite. To use your favorites from this screen, you'll just click custom and I can see my new COPD template here. So that's an option. Any questions on kind of that last grouping of workflow page components?
Nope, that's nice.
Okay. Our next section is follow-up. So if they just need to follow up with their PCP, I can select that. And it'll fill out that information. I can choose to modify it and change any details about that visit. So maybe they only need to come see their PCP if needed, or they need to follow up in a month for a med change. And then I can save that information. So now it's going to pull in med change follow-up in a month into that paperwork the patient goes home with. Next, I have forms, so I can see that comprehensive intake that my nurse did for me earlier. If I click my form, I can also choose to modify it. On the left here, there's that option for more vitals, and this is where you would get to your orthostatics if you needed them. You'll just mark those values, and then you'll click the green check in the upper left. Our next section is recommendations. So based on the age, gender of our patient, along with their comorbidities, you're going to get health recommendations. The common one I always think of is your colorectal screening, your colonoscopy. Based on the age and criteria, it'll flag patients due for a colonoscopy, other items like that. You'll get your diabetic foot exam for your diabetics. And this is not working right now because we're in our test environment.
That will automatically update when we have actual data, like when a colonoscopy report goes in, it will update that they're up to date on their colonoscopy.
So if it was ordered and completed on the community work system, it's going to update it, but it's not going to update if necessarily recommendations change. So maybe the colonoscopy recommendations come back and they need to have one again in another 3 years. You'll have to update that schedule. Or staff will have to update that schedule, if that makes sense.
Will it show you the date of the last colonoscopy automatically, or only if somebody manually enters it into that field?
So if it was completed on the community work system, it'll flag what the date that that study was completed. But let's say you go and look at that study and you realize when you reviewed it that they need to be flipped to a 3-year schedule, you'll modify the schedule for that event.
Okay.
Does that make sense? Okay. Next, I have my immunizations. So we're on our test patient here that's 64. They've aged out of quite a few vaccinations. I can see what they're overdue for and what they're in range for. As immunizations are administered, this section is going to automatically satisfy, and your nursing staff can also choose to document or import from a registry on this patient. Visits, so you'll be able to see what their future appointments are, what their current appointment is, and anything they've had in the past for future scheduled visits. So maybe you're trying to see they're here for an acute visit and they're also due for a maintenance visit soon. You'll be able to see if they're already scheduled. Next, I have my health concerns. So here on the right, just to give you an idea, behavioral, family, financial, transportation issues, or safety items that need to be documented. It'll show up on the record for kind of everyone to see. So maybe they don't get rides to their PCP appointments like they should. So that's why they end up in the emergency room all the time. Items like that. Or safety concerns, financial concerns, you can document those. Goals and interventions, this is more so of an inpatient component. The common example I think of, they need to be able to walk this far before they can go home unassisted. I've seen it also used as behavior goals in terms of medication compliance and items like that, smoking cessation. Sky's kind of the limit on how you'd like to use this section. Clinical media will allow you to upload images to the record. So maybe I came into the clinic with a laceration on my leg that you sewn up. You could take a picture pre and post and pull that into your documentation. Or if I come in with a rash, spider bite, items like that, you can easily take a picture and document that in the system. Reminders. So these are reminders for you related to that patient, or reminders for your staff related to that patient. So maybe they want you, you want your staff to call back ZZ test physician in a week to remind them to go get their blood work because they never go in and get it. Items like that. So it's just kind of a message. So here on the right, I can just click that plus, and it will create a reminder. I can send it to whichever staff member or even to myself, and it's a body just like an email that I can document in. I'm going to go ahead and send this to myself and have it show up in a minute so we can look at it later. Yes?
Yes, we had a question regarding media. You said we could put photographs in video also?
It will accept video too, but you can't view the video from this screen. You'll have to go into the header of the section.
Okay.
So does the app have a built-in process to capture a photo, like from a cell phone, for example?
Yep, so you guys have PowerChart Touch?
Yes.
Okay, so Power Chart Touch, you'll tap the record and you'll take a picture of the patient. It's going to easily accept images. If you're trying to upload video, though, you'll have to do it from a PC.
Okay.
Our next section is our assessment and plan. So I get a sub-diagnosis from every item on my problem list, and I can easily document in this. So I just simply click in and dictate. If I have the pad, I just tap and begin to dictate. I can also type, or maybe I have an auto text for management for my diabetes that I want to pull in. Lots of options. You also have a big free text section at the bottom if maybe all of these are related and I just have one single plan. So I can document it in here. Our next section is a procedure section. So IUD insertion, other items that you may do as part of a regular clinic visit. You can click in this box and just pull in your template. Knee injections, lots of options in here. So remember our period and our capital P. If you do knee injections, you have your own auto text for a knee injection that you pull in, and then you can kind of dictate your way through it. The sky is kind of the limit on that. Okay. I'm going to go ahead and refresh my screen on the right side. And just go ahead and choose yes, it's this one. Did we have any questions on our workflow components, which are our items on our white menu here on the left? Okay. So our flow from a clinic visit, I'm going to open my patient from the schedule. The color has changed here because I've begun to document. And it's going to pull up. I can review my chief complaints, go down and look at what my patient's taking, vitals, lab results, go to documents and see what I wrote about last for my patients, all those items. I go and see them. When I come out next, I can go to my problem list and I can just add a diagnosis. So at this time, let's see. Just go ahead and add chest pain as a diagnosis because that was part of our chief complaint. And that's going to pull in. I can mark anything chronic as appropriate or uncheck chronic if no longer needed. And then I can go down to new order entry and order anything my patient may need. So based on this study, they need a chest x-ray. I can just look for XR for my x-ray and the words CH for chest, and I'll just choose that to view chest. I'm going to single left click and it's going to turn blue, and it's going to add to my cart or orders for signature in the upper right. So I have my green number 1. When I click my green number 1, it's going to pull in my diagnosis list from before. And I'm going to go ahead and click modify details. And expand this window and single click on my chest x-ray. I have a blue circle with the white X because I'm missing a detail. And what I'm missing is my reason for exam. So shortness of breath. If for some reason I need a specific view of a patient, weight bearing, items like that, I would put that information in special instructions. You can also use your dragon in special instructions. Any questions related to how I pulled up my 2-view chest x-ray, how I got to this screen, or how I went in and satisfied that blue circle with a white X?
So does it automatically associate the text with every diagnosis that you have used for the visit?
So on that screen, yes. So let me go ahead and show you this one more time. When I go up to my carts, I kind of get my grid. So maybe I don't want to associate this with my diabetic neuropathy. I can single left click and remove. The other option, and the reason these defaulted, is because I have this box checked to always default associate. If I uncheck it, I can choose to kind of clear these out. So it'll be blank, and then I can just click in those boxes. Goodness. It'll be blank like this.
Everything we order, we have to go through that second set of windows that you opened to put in the reason for the exam?
Yes. So I would kind of go to my new order entry. search for anything I needed. So I could look for the chest x-ray. If maybe I needed a sputum culture and my visit charge, I could look for everything I needed at once. It would go to my cart in the upper right, my green number 1, and I would make sure my diagnosis is associated correctly. And if I don't need to do anything else with these orders, if they're just ready to be signed, I can click sign. The only reason I went into modify was for demo purposes and because this is a chest x-ray and I know I'm going to have that reason for exam.
It won't accept the fact that you put a diagnosis of pneumonia associated with it as a reason for exam?
No, it won't, because that reason for exam goes to radiology. I'm going to say that one more time because of the feedback. That reason for exam is going to go to radiology, not the diagnosis on that. It's a required field. So even if I were to just click sign at this point, it's going to pull me to this screen and ask me to fill out this reason for exam.
That seems pretty redundant.
It is pretty redundant, Dr. Kuzner. It's also a CMS requirement.
Currently, when we order a chest x-ray and we associate it with the diagnosis, like, that diagnosis goes to radiology, you know.
Radiology enters in the reason for exam right now.
Okay. Something important that I want to point out, this is going to default as an order for future visit because this study is going to take place at the hospital, not in the clinic necessarily. So it's going to default as a future order that can then be activated on that encounter that they create for the radiology test at the hospital. I'm going to go ahead and click sign in the right, and that's going to place this order. Okay. Next type of order that I want to go over, we'll just kind of pull in your run-of-the-mill. I'll just look for a CBC. We have our with, diff, and without. I'll just choose the with, single click now that it's blue. And when I go to the upper right, you noticed I unchecked my box and now these are all unchecked. So maybe this is actually for their diabetes and their COPD. I can just click on those columns. The other option is there's associate with all. If I have multiple rows, I can click associate with all. Here on the left, there's also the option to clear the row that I can select. For now, there's no other required details on our CBC, but I'm going to click modify just to make sure you guys don't have questions about the fields. And then I'm going to click my CBC. So your specimen type is going to default based on the test. Collection priority, unless you're in the ED, is going to default to routine. Frequency is also going to default to once. Now looking at this CBC, maybe I want to in the future for 6 months from now as part of the routine blood work. If I click my little calendar here on the left, I can choose, so I want my patient to come get this blood work in approximately 6 months. I can fill out that information and click OK. When I look at this, my order is going to be active kind of a month before and a month after for my patient to come get that test from 3/25. Okay. And then I'm just going to go ahead and click OK. Now, maybe I had multiple tests on this screen that were all going to be done within 6 months. I can left click on this test and pull and highlight them all and fill out that calendar once.
Will it let you order one for today and one for 6 months also? And that it's two separate orders, or is there a way to do that field?
So you were asking if one order could satisfy ordering one for today for them to go to lab and get it drawn and one for them to come get in 6 months?
Yeah.
Okay. So when I go to order for a future visit, I can choose reoccurring order. I want this to take place every 6 months for the next 2. So first occurrence, you would just change it to today. So I can even click in here and just press T on my keyboard and it's going to snap in. So this is going to place the one order for today to be active and one order for within 6 months. And also keep in mind, if I had 3 lab tests that needed to take place today and in 6 months, I could highlight them all and do this once. So I'm going to go ahead and sign this into the record so you can see what it's going to do. And if you remember before, I talked about order profile and showing you everything on our patient. So if you look at our CBC, I have my one for today, and I have my one for on March 25th. Okay. I'm going to go ahead and go back to new order entry. The next thing I always look for is an injection. So I'll just look for my TDAP. So I'll select my vaccine order. So you're going to look for the name of the vaccine. It's going to turn blue, and it's going to go to my card on the right. I'm going to associate my diagnosis as appropriate. So maybe this was a dirty wound. I'll check that box. And then I'm going to click modify again. If I click sign, it's going to result in the same action for this because it's an order set. Order sets on Cerner are a collection of orders. So these are kind of preset. If I look at the top on this one, it's preset for a vaccine. It's the charge for the vaccination, the charge for the shot itself, and then the medication order for nursing. It's going to already be pre-defaulted. When I look at this in the center, though, I'm just going to choose if this is the only shot my patient's getting or if they're getting an additional vaccine today. So I'll just check that box. And in the bottom right, I'm going to go ahead and select initiate now. I want this today in clinic. So I'm going to click initiate now, orders for signature, and then I'm going to sign that in. We just have those 3 clicks there because it's a collection of orders. Does that injection workflow make sense? Do we want to see it again?
I have a question about that.
Okay.
So currently, like for a shingles vaccine, we order those from the pharmacy, and then the pharmacy ships them to us, and they're administered at a later date. So how would that look in this workflow?
Okay, so you technically issue a prescription to the pharmacy, they order the medication, dispense it to the patient, and the patient comes back for the vaccination?
Correct.
Okay, so it's going to be a prescription. You would just go to Meds as RX and look for your Shingrix. I'm going to single click on that and go to my cart. You would choose your diagnosis, and I'll click modify here. So this is a prescription. It looks a little bit different. Here at the right, you can see it's kind of defaulting to my personal printer. It'll default to the pharmacy in your case when you're set up for e-prescribe. So let's see, do you guys have Walgreens up there or Walmart? It'll default to that location, whatever's preset for the patient. And I'll come back to prescriptions, but you can change any of these details here. When I click sign at this point, and I'll just choose do not send so I don't get a copy. If it's true e-prescribe, you'll get a pop-up on your screen that has your name, patient name, what you're sending, and to which pharmacy. And then you'll just click sign and it will go. Now for the second part of your workflow question. Yep. The second part of your workflow question is, how do I administer a patient's own supply? So let me see if they've got an order set. I can talk to Jules and talk to the ambulatory team. It's going to function just the same. You're just not going to have the charge necessarily for the medication because the medication was patient provided.
Okay. Thank you.
Let me write that down real quick. Some other common ones that I see are like Xarelto, testosterone injections where the patient brings their own supply. Is that something you guys also do? Allergy injections?
Yes, we do. We do allergy shots, and I think there are at least some people who do testosterone injections.
Okay.
Well,
The next item that you're going to order for every clinic visit when you go to mine. Let's see. You can go to visit charges on this. So let's say this is an established patient and today was an acute visit, and we'll say it was a level 3, I'll just single click on that. It's going to turn blue and go up to my cart. I'm going to check my diagnosis, and then I can click sign. Now, please remember you can order all of those at once, just so you can go to your cart once, go up to modify, make your changes, and then just sign them all together. I just kind of went one by one for the sake of practice. And then I'll just click sign on that, and that's going to place our visit level charge for today.
So the visit charge goes in as an order under new order entry, is that correct?
Yes, that's correct. Okay. Some other items, key points for our clinic workflow, patient instructions. You're going to need to fill out that section as appropriate. We're going to choose a patient education like we did earlier, and you're also going to choose that follow-up information. The other item that's left is our patient med reconciliation, and that's going to take place under our home medications. So I'm going to click home medications, and then I follow my cursor over to the right. I'm going to select outpatient. It's going to open up a new window for me. So here on the left, I can see my little scroll. So my documented home medications. Below that, I see our Tdap that nursing hasn't administered yet. And on the right, I can see my Shingrix vaccination that I wrote earlier. At the top, looking at this screen, I have my green arrow for continue, my little pill bottle if I needed to issue a refill or create a new prescription, and my little red square over here that indicates I wanted to stop a medication. For now, I'm just going to stop our Tdap shot and continue our home meds. Now, maybe I'm not making a change to documented home meds. This was an acute visit and they just need to go home on an antibiotic or something like that. And the bottom right side of our screen, I have 2 buttons that are very helpful, especially when patients have lots of home meds. I can acknowledge the remaining home meds, which is going to mark my green column for all of my home meds, or I can do not continue remaining orders, which is going to stop our Tdap vaccination in this case. This do not continue remaining orders button is very nice in the hospital because it'll stop those hospital orders. So for now, I'm just going to choose acknowledge remaining home meds. And looking at this, maybe when I evaluated my patient, I need to write a new prescription. I can go to the plus on the left to write that prescription. It's going to open up our new window. In this search box, I can look for any prescription at this time. So I'm just going to click in here and we'll just look for some singular. I'll just choose that 10 milligram tablet and it's going to add in the background. If I needed to order additional scripts, I can also do that at this time. So I can just continue to search. For now, though, I'm going to go ahead and click done in the bottom right. And I can look at my prescription below. So here's my singular. If I click my drop down here on the right, I'm also going to see all the other forms that this medication comes in. This is nice for peds because maybe you chose one and you're like, wait a second, I want the higher concentration. You can choose that so a patient doesn't have to take as much of the medication. From left to right here, I can update the dosage line. So maybe I want 1 tab oral, but for some reason I wanted BID. I can just key that in and it will correct. For duration, if I update this, so I wanted to do a 90-day supply or a 30-day supply, I'll choose 30. It will do the math for you. So if I kind of work from left to right, it'll calculate the number of tablets to dispense. Looking at this though, an item that will not, if I mark this as a PRN, so maybe it's PRN for allergy symptoms, it's going to clear out that dispense amount and I'll need to choose how many to give my patient. So maybe I only want to give them 50 and I'll fill that out. I have my refill drop down here on the right, so I can choose how many to give them. Your type of therapy here are singular flagged as maintenance. If you're giving Norco antibiotic, it's going to file as acute. And if you fill out that duration, it will calculate for you. Note to pharmacy is going to go directly to the pharmacy. Special instructions will print on the label of the script. This is where you'll document like your prednisone tapers. So you'll document in there. Stop date and time. DAW is dispense as written. Earliest fill dates. Some states allow you to issue controlled substance prescriptions for up to 90 days for well managed. So you could write 3 scripts for, let's say, an ADHD medicine. This is going to be June, this is going to be July, this is going to be August, and you can write all of those during that appointment. I'm not sure about your state's rules though. On the right, I have start date and time for that script if maybe they need to wait. And maybe this was my prednisone taper and I had dictated it perfectly in special instructions, and I don't want to have to change it each time. So to save this as a favorite in the upper right where it's blue, I can right click on my order and select add to favorites. And this will just add to my prescription favorites. So I'm going to go ahead and click OK. And now maybe this is my patient, my new next patient, and they also need that script. I can go to the plus on the left and I can click my star, and right there's my singular for me to use again. So just kind of keep that in mind. That's something you can kind of build up during concierge. I'm going to go ahead and click done on this screen. And then the right side here, I can see that it says do not send call to pharmacy. This screen's going to populate preset with whatever the pharmacy that was put in by nursing staff for you. Now, some patients also have mail orders or kind of go to 2 or 3 places depending on which direction they're heading that day. Under send to, you'll have 3 or 4 preset options, and you can always go to the 3 lines to look for another pharmacy. And if for some reason you needed to print off a script, like it's for crutches, something like that, for them to take to a supply place, you can also choose to print that script. What questions do you have for me around the med reconciliation, prescription orders? How would I order this particular item in the clinic? Anything like that.
Does this system have an option to hook up with the pharmacy data to be able to see what meds have been filled at a pharmacy or when the last fill was based on the pharmacy's data?
Yes, not from this screen though. So I'm going to go ahead and click sign. Do we have other questions related to this screen or prescriptions? Okay. So I'm going to go ahead and click sign then. This would technically issue those prescriptions I had pulled in. So I can see that estimated supply remaining. Now, so it's a nursing function typically. When I go through med history here, I can select that. And there's something called external RX history. So this will pull up that pharmacy history. So what they've had filled, when was the last time they filled maybe their metformin, items like that. So I'll just choose to import it. You're going to consent granted. It's going to come back blank because we're in that test environment and not on a test patient. But it'll pull from that pharmacy history. Now there's certain factors that have to match. So like the age, gender of your patient, the zip code of where they live. If I'm Robert Williams, I can't be Rob Williams at the pharmacy. It's not necessarily going to match. So just keep that in mind. Okay. And then I'm going to click done in the bottom right. The only item that's left for this clinic appointment is my note. To complete that note, I'm just going to scroll down and select office visit note. But I want to quickly go back to our ambulatory organizer or our home button here on the left, just to kind of show you what I was talking about for open items. When I put my cursor over this, it's saying I haven't started my note or started my charge. When I refresh here on the right and put my cursor back over that, it's going to let me know my note's still not started. So I can just go back to my patient and select my office visit notes, so my blue link. So I scroll down to the bottom of my ambulatory workflow page and I'm just going to select office visit note. It's going to take everything I kind of completed in that workflow page and pull it into my note. So chief complaint, my HPI, review of systems, our vitals, the procedure template, our assessment and plan, orders, my follow-up information. And what's also nice is I will see my prescriptions in here and the patient education provided. On the right side, I have my problem list, procedure history, medications they're on, allergies, social history, and family. Labs.
In looking at that, say you realize that you forgot to put something in your HPI or you see a typo, can you edit it from this screen or do you have to go back out to edit?
I have full editing capability here, and my Dragon also works here along with my auto text.
Is it an option wanted to, is it an option to create the note and then just do the documentation completely from this screen?
Yes, but what I typically see is maybe you forgot to add a diagnosis and you end up free texting it in here and then it doesn't carry forward to the next time or carry forward to the orders you need to place. So there's certain things that you kind of need to do in the workflow page first before you create that note, if you go that route.
Gotcha. And you can't do any orders with this page.
No, you cannot. So 2 more quick auto texts that I want to show you. I know we're running out of time. Under lab results, if I click into this field, I can put in a period in a lowercase l, and it will pull back templates. So maybe I want all the blood work from the last 6 months, or I want all the blood work from the last month when the patient just went and had it. I can press enter on this and check the box to acknowledge this is a one-time thing when you use it, and I'll click OK, and it will pull back the result in kind of a grid-like format for me. I have the same option for diagnostics. It's a period in a lowercase r, these radiology ones up top. So maybe they just had a chest x-ray last month or a CT and I want to pull that report back. I can press enter and it's going to pull in those subsections. So this will pull back that impression and plan from those radiology reports. So just keep that in mind. Spell check is also a thing on this screen if you do find yourself typing in here or dictating in here. What questions do you have for me about our office visit note template? Okay. Something I want to point out, you see our goals and interventions component here. It does not have any information in here. You do not need to remove it. When you click sign and submit and sign this in as a legal document, those sections are going to automatically fall out. So I'm going to go ahead and sign and submit my note, and then I'll click sign. When I click sign, this is a legal document. And I can go to documents now. I'm going to refresh so we can see it. And I can click my note. So now when I scroll down, my goals and interventions section is gone.
When that note has been signed and submitted, can the billers still add quality codes and that kind of stuff to it?
Yes.
Signed
So-
billing also is done.
So I can't go in and edit the body of the note per se, but I can add an addendum. So I'm going to go ahead and click modify just to kind of show you what it looks like. At the bottom, it's insert addendum. So let's say billing had a question about a diagnosis. They asked you, you answered it. You've got that paper trail. When I click sign, let me go ahead and refresh. So first of all, addendums, you're going to get our little triangle for your delta for change. When I click on this though, and I'm viewing it, so the screen that billing looks at, it's got document contains addenda at the very top. It's very apparent that an addendum was added at the bottom. Or were you more so after them being able to edit the body of the note? Did that answer your question?
So the billers would add all of the, because usually we don't necessarily put on all of the quality codes, and I don't know if this system does any of that automatically, but so the billers would have to put additional codes on as an addendum if there was CPT codes and that kind of stuff, G codes for Medicare.
So those billing codes, CPTs, they're going to be placed as an order, so they can go in and put them in through PowerChart or through another method.
And can they do that even after I sign the note, or do I delay signing the note until that's completed?
They can do it after you've signed the note.
Okay, thank you.
Okay. Any other questions related to our note template? Okay. So for every clinic visit, you're going to do your visit charge, your note, your med reconciliation, your patient education, and your follow-up. Do you have any questions about how to complete those items, how I wrote a prescription, how I even got into the chart from here? All right, thank you all for your time. To properly exit out of here, then I'll just close the record. And then I'll click my exit button up here. I'll get this recording posted later today.
Can I ask you a question, Melissa?
Of course.
I have a couple of visiting specialists who will need to be trained on this system, oncology and urology specifically.